there's a lot of information that you guys have generated here. I can just see from the tables there, and we're only going to have a chance to talk about a little bit of it. So the facilitator at the table, the job will be to gather that stuff up, and in the next 48 hours sort of condense it down into legible English or a language of your choice, so that we can capture that stuff. Because this is what we're going to use to really reflect the direction going forward. And we really want to capture the ideas that have been generated here from the group so that we can reflect what people have been thinking about. So, so as long as our team has that direction, we should be in good shape. And of course, if anyone wants to volunteer to edit or to weigh in on that over the next couple of days, we would certainly welcome your participation. So, is that clear? Great.
Okay, I'm standing here because we're going to start. You can't have a data portal without content to put on that portal, right? So it makes sense, right, to start with the data sets that belong in the portal. We're going to ask Cheryl to report out, take about 3 or 4 minutes, and tell us what you found about new data sets that you think should be on here, or even old data sets.
Great, thank you. We had a fantastic group and a really lively discussion, and we just couldn't write them down fast enough. So it's very exciting, a lot of great ideas. I'm just gonna read through the types of data sets that were suggested first, and then some of the considerations that came up too. People were talking about easy wins. Healthy People 2020, Let's Get Healthy California, demographics from the Department of Finance, births, low birth weight by zip level. We had a discussion about we should really talk about, level of granularity when we're specifying the data sets, and some we did, some we didn't. Cause-specific mortality, some of the data sets that ST already talked about. Cancer incidence from the cancer registry, long-term care facilities, and the suggestion was made that not only the address of the facility, but maybe pictures, maybe images and other types of data could be folded in there. Various quality metrics. Actually, I'm going to circle back to that related to facilities. We talked about restaurant inspection scores and some of the data that's really local, it's local jurisdictional data, and whether there was an opportunity to aggregate that into the portal. And it's kind of an open question, but it's thought that we might provide that opportunity for local areas to aggregate and even see how many areas are reporting their restaurant inspection scores. Child abuse and neglect. We talked about MD, like primary doctors, physicians, locations. It's a very messy database. It's not really available, but we talked about the incredible value of that. We talked about information and referral. Greg, you'll like that. About, again, difficult, but it's something we should struggle with, and maybe getting in touch with 211s and various folks. We talked about the network of care efforts and maybe trying to capture some of the data that they're capturing that will be as part of the digital library of the University of California. So maybe a little bit further out, but we talked about WIC data. WIC data is incredibly valuable statewide. They've got the locations of WIC stores, the breastfeeding weight among 3- and 4-year-olds, the unenrolled but eligible for WIC, so a lot of different metrics around that. We talked about, from the California Department of Ed, things like dropout rates, graduation rates, but also they keep the data on, some of the best data on overweight. They measure heights and weights in 5th, 7th, and 9th graders, and so that would be a really important data set. Immunization data of all types. Enrollment from Covered California. Maybe there's some data that we can publish from the state's enrollment portal. And it goes on. We talked about licensing and certification from the certification division, compliance and fines and various kind of inspections, data. Yeah, that's all I can say about that. I have to learn more. Hospital-acquired infection, which was already discussed. Survey data. We talked about CHIS, BRFSS, the maternal infant health assessment data, California Healthy Kids, all kinds of survey data that provide important behavioral characteristics for the population. Public safety, Measures of community environments, walkable streets, noise, crime, community safety. Child support services, we were talking about some of the data that they have there. I'm going to circle back to that because there were some other considerations. Hospitalization data, in addition to the patient level data, which requires some definite, methods to ensure the confidentiality, but those methods actually exist with OSHPD, and so they're going to be happy to step up and provide us with that expertise. But there's also information about facilities, about financial reports, utilization reports, and other really useful information coming out of them. How they meet the quality standards that are set by the federal government, patient safety, pediatric care. So all kinds of quality metrics that come out of OSHPD. We talked about jail health and corrections. It's this huge population, but it doesn't exactly come under the state domain, but very difficult to aggregate. Important population. Let's see. We talked about the California Highway Patrol data. So there's accident or unintentional injuries, all kinds of things, crashes, but also juvenile. There are other data from California Highway Patrol that would be really useful. So some other considerations that we talked about when it came to data, one idea was to have some kind of requirements about the standards of reporting. So metadata, all those things, but some requirement about reporting about quality, how frequently the data set's updated, how complete it is, things like that, and just putting that out there and not making it onerous, but having at least a core set, and then any additional information that programs want to report would be great. We talked about kind of mining the field around the child support services. They really need some standards around tagging and looking at various attributes of around their metadata and attributes of their data. So we thought that this group could act as some intelligence on that and maybe bringing some best practices back. We talked about the characteristics of the catalog, the searching, the categories, so that you could search for geography if you wanted all the data sets that were available at a zip code level or some other geographic level that would be easily searchable. Let's see. Yeah, I think that's pretty much it. We did circle around to confidentiality and standards around that.
Is that all? So no, that's a great list. What I like about it is that it's not just CDPH, it's not even just CHHS. I mean, I heard certainly OSHPD and other Department of Social Services, but it also includes, the police data. It includes California Department of Education data, which is great. Okay, so now we have our data on the portal. We need to start doing engagement, and Shell's going to turn to one of the groups for that.
Strategies to engage other key government and non-governmental stakeholders. So, what did you guys come up with?
So we broke it down into, Daniel's covering his eyes, 6, 12, and 24 months, as the chart showed. And thought of, for the first 6 months, to really put together some directories, a list of all the agencies that we want to partner with, both in government and out of government, and including in those departments all the employees, to really make sure that everyone in government, everyone who works for government, understands what open data is and wants to participate. We're going to put together a calendar of all regularly scheduled meetings, both in and out, or both within government and outside of government, so that we can get on their agendas to talk about open data, and a designation of who should go and present about open data. In the first 6 months, we were very clear we need a branding, a product, something that gets people excited about open data. It could be the video that's being produced on this, or lots of things that the presenters showed that could be shown in public meetings, can be shown at staff meetings, and that within the 6 months, developing an email to be sent to each and every employee of the state talking about the Health and Human Services Open Data Project, which would embed in that email a copy of this video so that they could understand what open data is. Developing LMS training, I got that right? As well as sharing with county, city, and provider partners and advocates. So the first 6 months is really just figuring out who do we need to access. The next 6 months is really then going to the meetings and presenting about open data and educating people about what is open data. And as part of that, this group is sponsoring a contest where the most interesting or coolest app or coolest data set will be chosen, or idea will be chosen by someone working in state government. And the contestants, in a sense, will then work with some of our leading industry partners, including Microsoft and IBM. They've already volunteered. Google's going to do it, and Socrates is going to do it. They are voluntold. And it's really going to be, we were thinking like The Voice, but except for the app. We're going to get, Shell's going to have chairs, she's going to spin around, and she's going to dress like, right. That really gets excitement and really sees the creativity that exists in state government. With a real minimal amount as a prize. It's more winning, which will be more exciting than the actual remuneration. That's going to be in the next 6 months, so that's within 12 months, having this statewide prize to develop the coolest data set or the coolest app. Also within those 12 months, partnering with private industry, holding stakeholder symposiums like we were having here. We suggested it be regionally so that counties and cities and private industry can participate to understand what open data is, to understand the benefits of open data, to understand what it's not, so that we can get rid of the fear that privacy and private information is going to be given out. And again, the first 12 months is to find those champions for open data, both in executive, in line workers, inside of government and outside of government. Then in the first 24 months, talk about success stories. You know, getting it out that what's been accomplished, how the portals are easy to use and navigate, easy to understand. You know, let's learn some of the lessons from Obamacare with the criticism that it wasn't easy to use, it wasn't easy to navigate, and to really benefit from our failure, and how helpful it is. Excuse me. And last, if we're going to engage employees, we've got to keep them aware of what's going on. So this group wants, on a monthly basis, something to go out to every employee through some kind of a mass as to where we are with open data. So that's us.
Thank you. Thanks, Richard. Wow, that was a lot. But now let's move to, it's synergistic with group number 5, because they've got strategies for communicating and sustaining activities across the state, local associations, and nonprofit organizations.
Right, and we think that probably this group over here was listening to us over here talking. So we talked about a lot of very similar things, and we didn't talk a lot about internally, but we talked mostly about externally. So we were really looking at the organizations, the media, and the other organizations outside that would be sort of stakeholders in this information. And one sentence here said, please identify the most compelling, effective, and efficient means for disseminating communications. And we turned that around and sort of thought about it more as a two-way dialogue between the folks inside of California who are putting the data out there or making the data available, and everybody else, so that it's a two-way communication. So some of the strategies we talked about were, we grouped them into online, which included websites, listservs, other kinds of groups, Twitter we thought was very important depending on who we were talking to. The second was existing collaborations with community organizations. The third was in-person gatherings, particularly meaning ones that we initiated ourselves, that the government initiated to create forums for information sharing both ways. Another way would be the seminars, hackathons, contests, like the contests mentioned over here. And finally, we talked about existing calendars of events, really knowing what was happening in the world, out there in the community, so that we could piggyback on events that already existed and send folks out to hear. So we talked about a couple timeframes for those things. We looking at the online resources happening within about 6 months, and also beginning in-person gatherings, starting those up within the first 6 months. Looking at the collaborations with community organizations, the seminars, hackathons, contests, and getting a handle on existing calendar events and going out there all throughout the year, but within the year. And measuring tools, we didn't match them up with each piece, but we talked a lot about how we would look at and measure and think about whether our strategy for outreach was effective. We talked about the sort of typical online measurements, like how many people are downloading data, how many requests for data are coming in, how many unique visitors to the website or the interactive portions of the website, how many comments, number of subscribers increasing on listservs, comments, unique number of visitors, attendees, the number of attendees at different in-person gatherings and the quality of their participation. And then we talked about things that were a little bit harder to measure, like the stuff that was created meeting a need, so that it wasn't just sort of new apps being put out there, but there were actually needs being met in the community. Number of entries in contests, number of tool uses, downloads of data, and then we got into a discussion about sort of the bigger goals. What are we doing all this for anyway? And that without the information from the first group that spoke over there, we really couldn't put measurements on there, but we wanted to just highlight the importance of knowing that there were some longer term goals of open data, like improved decision making, the programmatic goals of the state and HHS being met, however they were linked with the open data, and a reduction in workload or some sort of measurement around the FOIA or the media requests, making an impact on that. So,
The next one is about catalyzing the innovation around use of this data. So I'm going to turn to group number 6 to give us a sense of what they've done. And before I forget, another plug, sign-up sheets over there. When you're done here, please do sign up for any and all the groups.
Thanks, Andy. That's not what we did. You have the right group. That's what was in the title, but in the details it says, how are you going to engage people in this process? So that's what we focused on. And we thought there's some chicken and the egg in there too. The more people get engaged, the greater the opportunity for innovation. So we said, to answer the question, how do we get people engaged, we came up with 4 buckets. The first bucket was around motivation, both for the internal folks who are making the data available and using that data, and for external people, the public who will be using that data. So how are we going to motivate them? We had a continuum from, some intrinsic motivation that feels good about working on this, all the way to buying a Cadillac for the group that came up with the best app. Now, Louise's statements for the state talked about carbon reduction, so we didn't think we'd get the state to pay for it, so Paul's buying a Cadillac for whoever does it. The other thing we thought would make motivation, would offer motivation, is some signal of sustainability of this thing. So it's not just going to happen and then go away. So the ideas the group came up with, I thought of the ADA. You know, every construction project, 1% of the budget of that thing has to go for ADA compliance type stuff. They suggested the same thing. Some portion of all IT budgets go toward open data somehow. All right, that's first bucket, motivation. The second one is mechanics. So we had examples from Illinois about bringing people from Groupon, and partner with those guys because they were interested in doing meaningful work, not just trying to make a paycheck, right? So we wanted to draw in some of those folks who would have a passion for doing this kind of work. There was a paradox. We talked about a skunk works kind of deal where you have to go underground to really make some stuff happen. So we thought that would be valuable, and at the same time talked about the value of governance and some top-level support. So we described it as a paradox. So motivation, mechanics, and then we got to make data available. And we got two descriptors on that. One is useful. So we would be deliberate about soliciting from internal folks what they needed to make their life easier. And we would try to make that kind of data available so my job is easier working there. That's one. And the other is to get something real topical. And the example we had again in Chicago, they built when they were closing all the schools, when Emmanuel was closing all the schools, somebody built an app that compared the reason for shutting the school down against actual performance metrics from the school. So created a lot of buzz in Chicago, but people got really interested in it. So get good data sets. And then the fourth bucket to try to get people engaged was personalization of doing the work. In other words, create some kind of motivation, some intrinsic motivation, so it's more than about making a paycheck, it's about really making a difference and having an impact with whatever app we create. Okay, so that's how we're going to engage people. Now, how are we going to measure that? At Shell's advice, we've got leading and lagging indicators. So the leading indicators are things we can measure right now. What can we measure today to find out if we're making a difference? Number of hits on the data set, quality of the data set, do you got missing data, do you got the right data in the right fields, does it improve efficiency? We talked about a survey on users. Are you missing any valuable information? Did you get your question answered when you accessed the data that we were looking at? Create events like webinars and then count how many people attend. So all those are things we can measure the result of right now. And then a lagging indicator, which is a positive thing as well, would be let's look at the strategic goals and find out if we're moving the needle on those things by using these applications that are here.
Great. Bill Davenhall, by the way, he was just mentioning to me, the car should be a Tesla. It's electric. It's here in California, you know, so. So the policy group over here, right, you guys are policy, they actually have say-so over that 1% rule, you know, the open data, 1% of the budget goes towards open data. So I want to give them a chance to, you know, offer their recommendations. Ooh, and they have a presentation, it looks like.
Process, huh? Okay, all right. The end of the day. Is this working? Okay, great. So we had fundamentally an existential experience, and it created a lot of angst for the facilitator. But we actually went all the way back to what is the definition of open data? And we really went back all the way to the beginning of the conference, human services and health, right? Data. And what we recognized was the presentation earlier in the afternoon looked as if the state of California has a lot of governance and policy already in place. Is it as simple as just putting in some type of, Terry was the suggest this, is it as simple as just making some change that enables the stewards of the data that exist already in the state to be able to feel as if they can free the data. I'm going to be a little bit more liberal than they are, right? But at the same time, the point is that the question really becomes is there are hundreds and hundreds and hundreds of data sets, right? And so we trust that the state of California, if it makes a commitment to open data, will participate in an open process that looks to the consumer to drive some of what they need. You know, so we had this question. Ultimately, the existential question was, is open data, where is it? Where's my question? The end to the means. You know, is open data as an end or is it a means, right? And so that's the real question. So you can simply say, we've sat here the whole 2 days saying open data, free the data, free the data, right? But when it gets to the question of which data, you know, we're talking about open systems and closed systems. You know, I've kind of used the term, you know, what's behind the firewall and what's in front of the firewall. And we had a really robust conversation. We also identified that there are 58 counties in the state of California, and how are they going to be able to interact with that? We don't think that we would be remiss in not recognizing that each 58 counties will take that information and localize it, and they'll take that information. How are they going to then contribute back to the recognition that we are trying to hit the target around how are we going to improve health and human services for the citizens of California, and how are we going to interpret that? So we narrowed our presentation to look at those kinds of data sets and what are we looking at. And so the question really becomes, we looked at recommending that there be consideration of a tiered way in which to look at rolling this out. And that, again, we agree with the previous presentations that we should be looking at data sets that are important to people, important to the outcomes that we're looking at. How do we get to outcomes? What are the outcomes we're looking for, and how do they get embedded into the definition of open data? And how do we make sure that we maintain the connection between health and human services? Because the tendency is health will drive the discussion and human services will lag behind in their way. How do we put human services and health, right? Which was the opening that Daniel gave to us earlier yesterday. And so we believe that the standardized governance models may be already available in some ways. There are already lots of strategic plans. And so how do you really get to the place where you emphasize it? I think your comments around how you keep people motivated and focused on it are really more important sometimes than having to write a whole bunch of governance and models and stuff like that. We recognize that what we're trying to do is concern around the validation of the data, right? So, you know, garbage in, garbage out, right? And then also we recognize finally that this is a culture change, and not to recognize this as a culture change and not to address that as a part of what the definition of open data is and how we're maintaining that connectivity, how we're putting out that information. And we agree that it should be, it shouldn't be just, you know, whoosh, you know. I mean, I heard at the table, what, 390 data sets were, well, Pamela, right, said that earlier, 390 data sets. Well, how many of those data sets are really important to what we're looking for as an outcome for the citizenry of California? So policy is driven by principles, and principles drive the actual execution, and it's a way in which you validate whether or not you're doing the work in the way in which you thought you should be doing it. So did I get it? That's the existential conversation that we had, right? And so we even went to, and my attitude is free the data, in doing you become, right? But then the point is that, well, maybe doing it, you might get yourself in trouble, right? That's the conservative point of view, right? So yeah. And so, yeah, and a lot of how do we do it, right? But, you know, you have to think about it. So the question is the train's already left the station? Or are we trying to pull back on the governor in order to be able to make sure that we don't go off the tracks like Bill was talking about? You know, he had his train off the tracks there. And so that's really what we had a very, very great conversation.
Okay, so the last group then, is going to tell us about how, what the determining success factors are for an open data pilot, given everything that we have already heard. And is that Ron or is that Jerry? Okay.
Group number one was very supportive of their facilitator and really didn't get into any existential sense at all. What I'd like to do is I'm going to share this with Ron, one of the members here. The process, or the topic we had, was determining success factors for an open data pilot. A little distracting because we're way past a pilot. There's a lot of places that are already doing this. It's just a matter of degree. The process we used was we started with, from the study group, 9 success factors, and we voted, multi-voted, and came up with the top 3 that then we discussed in more detail later. We also then, the process was, we also then looked at, well, what other success factors, and came up with another dozen or so, and then we multi-voted there and came up with another top 3. So our content that we looked at from a timing standpoint, or how we measure it, and what we look at in 6, 12, 24, or further months in this open data, was really based on those major 6 factors, though we have a lot of input on and conversation on the other 6, or on the other probably 20 or so. So with that, I'll turn it over to Ron, and he could deal with the content.
All right, the top 4 factors in determining the success factors for our open data pilot, or like I like to call it, kill the PDFs. Number 4, quality data. So the measures and metrics for determining quality data are, first, obtaining an inventory of everything that we have in the agency so that we know exactly where everything is. I don't think we have that today. That each data set that is published on any agency website has a known quality standard, and a quality standard can be 0. A data dictionary standard, so that each data set has a human English description of exactly what that piece of data is. And the timeframes for those are somewhat immediate, that they're yes or no answers to each of those questions. Number 3, the increased access to timely data with an efficient process. All of the departments and in the agency probably do this in a multitude of ways, of putting data out for public consumption or responding to Public Record Act requests. And we think that there's a way to do this in a single fashion for the whole agency, so that there's a single gateway for any of the data needs. And I can speak for our own department, Public Health, that we have 240 programs within the department, and they all do it a different way. Another metric that we would use for an increased access to timely data is simply, and a lot of you said this, is a page view of the actual data set. That's really simple to capture. But another piece, another metric or a measure that should be included with all the data sets that might be part of this open data portal is a simple date calculation as to when that data was published. I know a lot of data sets might be out there and you don't know if it's current or 2 years old, and how useful would that be for you. The number 2 success factor for an open data pilot is the innovative applications of the data. And like I think this group mentioned with the app idea, once we get all the data sets published, it's a simple count for how many applications were created utilizing this open data sets that we put out there. And then another metric would be the number of downloads or views for each of those apps that were invented. And then the number 1 success factor for the open data is evidence of improved health outcomes and awareness of the key issues. The metric for that is we need a documentation on exactly what those health issues are, and we think that one's a little farther off, probably reasonably accomplished within 24 months. So that's what we have, and thank you.